This is the clavicle. The clavicle lies at the root of the neck. It lies transversely. It is subcutaneous, so it is more liable for injury and fractures. It has a sternal end which is globular, and this sternal end is related to the sternum for the sternoclavicular joint. The sternoclavicular joint lies between this end and the sternum, and also the undersurface with the costal cartilage. So if I mark this area in the practical exam and say name structures related to the colored area, it means the sternoclavicular joint. It has also a acromial end, and this acromial end is flattened, but this is globular. And if I mark the end of this end and say name the structure related to the colored area, so the acromioclavicular joint. The shaft of the clavicle has its medial 2/3 convex forward and its lateral third concave forward. The anterior surface is smooth, the superior surface is smooth, and also the posterior surface is smooth. Only the inferior surface of the clavicle, which has grooves and ridges and tubercles. So it is characteristic for this. So if you look at this surface and find this groove or roughness or something, so this is the inferior surface of the clavicle. Otherwise, any surface, anterior, superior, and posterior, is smooth. If I look, this is the anterior surface of the clavicle. If I mark this area and then name the structure attached to the colored area, so this is the clavicular head of the pectoralis major muscle. If I mark the front of lateral third here and this is the attachment for the anterior fibers of the deltoid muscle. So on the posterior surface here, the posterior surface of the lateral third of the clavicle here, this is the insertion of the upper fibers of the trapezius. So if the anterior surface, you'll find a line like that on this convex area, and this is the clavicular head of pectoralis major. If you find on this concave area, this is the deltoid muscle. If on the posterior surface, this is the trapezius muscle. On the inferior surface, I'll find, this is the medial end, I'll find a rough area here. This rough area here for the attachment of the costoclavicular ligament. Costoclavicular ligament. So if I mark this area by rounded marker, name the structure attached to the costoclavicular ligament. And this groove, this is for the insertion of the subclavius muscle. And this important conoid tubercle and trapezoid ridge. Here is the attachment of the coracoclavicular ligament, the strong ligament that transmits power from the upper limb to the axial skeleton. So this is the attachment for the coracoclavicular ligament. Coracoclavicular ligament. This is by far the commonest areas in the clavicles. Stop it.